here today with Dr. Aline LaPierre, the founder and originator of the NeuroAffective Touch modality in psychotherapy, and I'm so excited to be speaking with her today and talking about this incredible and revolutionary model. And I'm so grateful. Thank you.
Oh, you're so welcome.
So tell us a little bit about this model and how it came to you.
You know, that's actually a simple question that's not so easy to answer, because I think it's the result of just a lifelong trying to learn to be in my own body. And discovering very early on that it was not so easy. Like I myself felt very disembodied, and started looking at dance or, you know, different ways of coming into my body. And but I was also interested in psychotherapy. And somehow through learning psychotherapy and through doing dance and through getting massages, I sort of it started just sort of organically coming together. You know, and particularly when I began to practice as a psychotherapist, and here we are sitting and having done a lot of dance, in particular a modality called Continuum, which was a beautiful modality of body awareness. I could see so much going on in a person's body, but as a psychotherapist, I felt like caged, you know, it's like, wait a minute, this doesn't make any sense. Here's the body going through, having a story to tell, having huge memories of what happened in its own life, and then here's the mind telling a different story. And so I began to feel the split really intensely.
It's really, it's Cartesian.
Yes.
And in the way that we become so disembodied in our culture, especially, we're reinforced for always thinking, and being present in that way, but not in a way that's really cognizant of what's happening below here.
Right.
So,
below here, below, right. And you know, so I became curious about bodywork modalities. And so as I was doing my psychotherapy training, I also started going around. There was massage, and then I discovered there was deep tissue, and then I discovered there was, you know, craniosacral work, and I became curious about all these different modalities and just went around and studied, and then somehow just thought, I'm going to take the leap and see how it works together.
Wow. So when you first started to integrate touch into your work psychotherapeutically, what were some of the things that you thought about in terms of how to bring this to people in a way that felt safe, that felt like they could really, you know, take from the work and generalize it into an overall track of healing in their lives?
Well, I always start by getting oriented to a person's history and their own history, like what was touch like in their family? Have they had abusive or inappropriate touch in their past? It's really important to start with the touch history. And then as I know that, I might notice, like when people talk, a lot of times they'll do little gestures, or they'll do this. And so we start with just sort of noticing, and I'll have them notice, did you notice when you talked about this, that you put your hand right here? It's like, yeah, and how does that affect you when you talk and touch a particular area of your body at the same time?
Oh, I love that. You're really helping people sort of stay integrated with what's happening somatically and whatever might be happening emotionally.
Right, and we all do it, you know, and the most common gesture that people do, you'll find, is they'll talk about something that's hurtful or that was difficult, and they'll do this, which is the heart, you know. And so I very soon realized that touch really is about the expression of the heart. And as I was learning about touch and about the body and about somatic work, it's like the hands are actually the extension of the heart. And so when we touch, we really are extending our heartfulness towards someone.
Well, that makes so much sense and gives a lot of context for why holding hands is such a gesture of love in a relationship.
That's right.
That's so beautiful.
Yeah.